Over the last year, I interviewed many of our community members and learned how each was making a difference in our missions. This video highlights just a few examples.
The reason that I went into education is the reason that I went into healthcare in the first place. It's all about the patient and their family in our communities. And as a physician, I feel that I can do a good job in caring for our patients and advancing their healthcare and improving their lives by serving people one-on-one. But the opportunity to train a generation of students to become outstanding healthcare providers is an opportunity to actually transform healthcare. And so being able to use patient-centered medical education throughout every single decision that we make is what drives me to do the work that we do every day.
In everything we do, the patient has to come first. And that's obvious in our direct interactions with the patient, but also as we're designing these research efforts and the academic pursuits that we have here, we always need to think that despite all the headwinds that we have, that our patients are our primary focus. And for me, that's number one.
I see DHIP really as the clinical engine that's driving Duke Health in all of our missions, right? It allows us to provide more care to more patients, but it also supports our research mission and our academic mission and our community health mission.
I think being in a very big healthcare system is what really makes it unique. As PTs, we are really taught to approach a very collaborative environment. And I feel like for Duke's PT program, they really double down on team-based learning, and that's how they approach the whole program. So you are grouped into a group of 5 to 6 people, and they'll be your ride or die for the next 3 years. So it really reinforces your behaviors and how you're communicating with others. And I feel like those skills you get along the way, it really helps prepare you for the future.
We're interested in the impact of heat stress on thermal adaptation of fungi. That is their ability to survive at higher temperatures. You may have seen the hit HBO series, The Last of Us, which actually, put out there this idea that thermal adaptation could lead to fungi being more severe disease causing. And while the story is fictional, there is actual truth that we're very concerned about this rising threat. And in particular, we're seeing the evolution of new fungi species in the environment that never used to cause disease, causing disease.
The big picture for us is that unfortunately cardiovascular disease is still the leading cause of death and disability.
Right.
The HA says by 2050, if we don't do anything, 61 million Americans will have cardiovascular disease risk factors outcomes. And what philanthropy does for us is really help us think about those moonshot-like projects and support the people to get there.
Duke is incredibly talented. The people here are extraordinarily talented, but they're also dedicated to Duke. People here at Duke really believe in the institution, want to support the institution, want to do right by the institution.
It is the people here that make it day to day so rewarding. The kind of ambition and humility that every Duke expert I work with exudes when they're sharing their background with a lawmaker. It changes policy ideas.
I'm incredibly proud of the work being done here, and thank you for everything that you do.